Do you suffer from intervertebral hernia? You have tried different methods of treatment, but the pain is still in your back. You have been offered surgery, but you prefer to avoid it. Then, this video is for you. Additional and manual treatment of disc hernia don't give stable results, just kill pain for some time. Surgical extraction of disc hernia, even made with an easy invasive method, doesn't eliminate the cause of sickness and can lead to disablement. Luckily for us, there is a person, Dr. Danilov, who can help us, who has learned all methods of manual therapy existing in the world, who made hundreds of operations on the spine and column, and thousands laboratory researches. The result of Dr. Danilov's exploration is the unique method of non-surgical treatment of hernia devised by him and patented in Ukraine, Russia and Switzerland. This is a vertebral revitological method. Today, Dr. Danilov is a professor, academic and author of the book Osteochondrosis for a Professional Patient. His method works successfully and has already helped many patients who had almost no hope. The method of Dr. Danilov has nothing in common with known chiropractic or osteopathy. With his procedures, Dr. Danilov changes biological mechanics of the spinal column, decreasing inner pressure on the damaged disc, producing special conditions for the disc regeneration. Although it was considered before that the degeneration had no reverse process. Here are some results of treatment according to Dr. Danilov's method. As they say, no comments.
Hi, I'm Dr. Bachman, and today we're going to talk about hamstring stretching, and in particular a doorway hamstring stretch. Very often when we're evaluating for low back pain, one of the first things we check is hamstring flexibility, in particular in flexion. So flexion is the kicking forward part of raising your leg, the part of hamstring flexibility. And if we see limitations there, very often that can be at least contributory and possibly even a cause of low back pain. So here we're going to look at today a way to stretch your own hamstring and evaluate your hamstring flexibility. So Cassandra, our therapist, has volunteered, thanks Cassandra, to show us the doorway stretch. So what she's done is she's laid on the floor. She's keeping her butt a little bit away from the wall there. Cassandra, go ahead and try stretching your leg up and setting it on the door jamb. So basically what we're shooting for is 1 to 2 minutes of aggressive but tolerable stretch on the hamstring while keeping this leg flat on the ground and this knee locked, which she's done. Is that a comfortable stretch for you, Cassandra? Not painful, not super burning? Okay. So if, for example, this particular angle of stretch was too much for you, you would scoot back on the ground a little. Exactly. And you would start there. And then ideally, you'll kind of ratchet forward in maybe 15-20 minute increments as your hamstring muscles relax and allow some more stretch. Now your goal is, and go ahead and slide forward, Cassandra. Your goal is to try to get to where you can put your butt right against the door jamb and have your leg extend upward against the jamb while, again, the other leg lays flat. This is 90 degrees hamstring flexibility and flexion and is optimal hamstring range of motion for most people. If you can attain this and hold it for at least 10 seconds, then you have optimal hamstring range of motion and flexion, and thereby can reduce your risk of low back pain or help relieve any back pain that you may have. Thanks a lot, Cassandra, and we'll talk to you guys.
Hi, it's Anthony here from Ballura. What I want to talk to you about today is some of the common problems we see in office-based workers who spend a lot of time in sitting. Many people in that type of work environment will find they get a lot of thoracic pain or pain between their shoulder blades, their neck, and often headaches. And there's two really simple exercises you can do to try and prevent these from occurring. So we're going to go through those. The first one is improving your thoracic rotation, which really just involves popping your arms across your chest and twisting as far as you can one way and as far as you can the other way. And you can do it while you're sitting in the chair. A couple of times every hour would be a great way to help you. The second one involves using a rolled up towel, just like I've got here. And we're going to put this on a bed up between your shoulder blades and lean back over it. It's a fantastic exercise. I'll show you what I mean. We're going to pop the towel on the bed, or if you're at home you could do it on the floor. We're going to make sure that when we lean back over it, it's right up between our shoulder blades. So your head is supported, hands out behind the back of you with your knees bent up. We're really putting you in the opposite position to what you're going to be spending most of your day in. You'll probably find it really comfortable. It's really good. This exercise can be done once or twice a day for 2 to 3 minutes each time. Both exercises will help you prevent pain between your shoulder blades, your neck, and getting headaches. Hope they go well. We'll see you next time.